Today we will discuss about TB. Tuberculosis, commonly known as TB. It is a bacterial infection that primarily affects the lungs. It is caused by bacterium Mycobacterium tuberculosis, which spreads from person to person through the air when an infected person coughs, sneezes, or talks. TB can also affect other parts of body, including the brain, kidneys, and spine. TB is a serious global health problem that affects millions of people every year. According to World Health Organization, TB is one of the top 10 causes of death worldwide and the leading causes of death from the single infectious agents. In 2020, an estimated 10 million people worldwide fell ill with TB and 1.5 million people died from the disease. Causes of TB. TB is caused by a bacteria which is called Mycobacterium tuberculosis, which is a slow growing bacteria that can survive in the body for long periods without causing symptoms. The bacterium is spread through the air. The bacterium is spread through the air when an infected person coughs, sneezes, or talks. People who inhale bacteria can become infected. However, not everyone who becomes infected with TB develops the diseases. In some cases, the immune system is able to fight off the bacteria and person remain asymptomatic. People who are at higher risk of developing TB include those with weakened immune systems such as people living with HIV, AIDS, malnourished people, and those with certain medical conditions such as diabetes. People who smoke or use drugs are also at higher risk to developing TB. Symptoms of TB. Symptoms of TB can vary depending on the part of body that is affected. The most common symptoms of TB that affect the lungs include cough that lasts for more than 2 weeks, chest pain, coughing up blood, fatigue, loud voice, loss of appetite, fever and night sweats. TB that affects other parts of body can cause a range of symptoms including back pain, headaches, and seizures.